demand. 3, facilitating enabling environment. And 4, the political leadership to advance all components, hence this conversation today. On the occasion of the anniversary of the Hand Hygiene for All initiative, we are taking stock of progress over the past 12 months as COVID-19 has forced us all to rethink and reprioritize our approaches and responses. And ladies and gentlemen, before I turn it to our first keynote speaker for today, Kellyanne Naylor, I'd like to cover some ground rules for the session. 1, audience members are muted upon entrance, as you would have noticed. The chat function is also disabled, so please use the Q&A function for your questions. There will be a chance for the panelists to respond to your questions later in the course of the event. The session is being recorded for our note-taking purposes. And finally, we have a very tight agenda. So I've asked the coordinator, Nat Painter, who is also the global coordinator for the Hand Hygiene for All initiative, to strictly enforce time limits. And once again, thank you all for joining. I look forward to a very lively discussion today. Please join me, ladies and gentlemen, in welcoming our first keynote speaker for today, Mrs. Kellyanne Naylor, Associate Director, WASH at UNICEF. Over to you, Kelly. You're most welcome.
Thank you so much, Kitch, for that introduction. It's really a delight and very fitting, Kitch, that you're chairing our session today. And I think many of us know that the African Sanitation Policy Guidelines initiative within AMCOW is just such a promising example of how we can really scale up hand hygiene and sanitation on the African continent. So we really, Kitch, count on your wisdom for guiding our discussion today. Dear distinguished guests, colleagues, and friends, I'm thrilled to be here, and it's just, I keep thinking back, it's really hard to believe that a year has passed since we launched the Hand Hygiene for All initiative. I think we've all, over these last years, we've many times said the words that hand hygiene is a demonstrated no regrets investment, and that the health, economic, and societal benefits are certainly widely understood among this audience today. I think we've talked about many times around the cost-effective ways that hand hygiene can prevent such a wide array of infectious diseases, whether they're respiratory like COVID-19, but also diarrheal diseases, which are among the leading causes of death for children under 5. We've talked about the return on investment and the OECD study of high-income countries, which reports that $1 invested in hand hygiene and healthcare facilities may bring as much as a $15 return in health expenditures alone. The ability to maintain personal hygiene has such an important role to play, not only in keeping us healthy, but also in reducing stress, particularly among women and people living with disabilities, increasing our feelings of dignity and pride, and decreasing any feelings related to disgust, fear, violence, injury, and shame. So if hand hygiene is so great and its benefits have been so widely known for over 150 years, why in 2021 are we still talking about it? As we've seen, these past two decades have really stepped up the attention on hand hygiene with a better understanding around behaviors, around barriers to hand washing, around the role that markets can play, policies, and the need for monitoring. In fact, our progress has been great. Over the past 5 years, 300,000 people per day have gained access to basic hand washing facilities. That's 500 million people. But yet, while we can take stock of our progress, we also can see in our latest joint monitoring program report by UNICEF and WHO, which was just released last week, it shows that hand washing rates continue to lag. And at our current rate of progress, almost 2 billion people risk to still lack access to basic hand washing facilities in 2030. But right now, even today, as a sector, we have an opportunity. COVID-19 has brought and continues to bring unprecedented attention upon hand hygiene, with increases in government champions, more resources, and above all, a greater sector commitment to make a long-lasting change. So in this first slide that's presented here today, last June, WHO and UNICEF launched the Hand Hygiene for All initiative, which convenes governments and leading sector organizations in the area of hand hygiene to convert this attention on an emergency response into sustained long-term programs. Today's event, as Kitch said, marks the 1-year anniversary of this initiative, and we're eager to reflect upon the progress that we've made these last 12 months, but really look ahead and chart our priorities for the coming year. The Hand Hygiene for All initiative focuses on strengthening the supply of hygiene goods and services, generating demand through evidence-informed behavior change programs, and developing robust policy environments to facilitate accelerating hand hygiene. The breadth of the partnership is important because we're focused on hand hygiene for all. In addition to traditional settings of homes, schools, and workplaces, we're bringing focus to refugee contexts, public spaces, workspaces, and others. Using a whole of government approach and a whole of society approach to truly leverage all the resources and capacities that all stakeholders can contribute to this effort. This initiative was designed in alignment with key UN, WHO, and UNICEF strategies, including the SDG 6 Global Acceleration Framework and its 5 accelerator areas. Next slide. We've prioritized 3 flagship programs to advance the hand hygiene sector. This October, on Global Hand Washing Day, we'll release the very first State of the World's Hygiene Report. This is a sister report to last year's report on the state of the world's sanitation, and it will capture the latest statistics on hand hygiene and the progress that we need to make towards achieving SDG targets, as well as providing encouraging case studies of countries who are making the type of transformative changes that are needed to accelerate our progress. We look forward to sharing this report later this year. We're also working with national governments on developing costed hand hygiene roadmaps. These roadmaps will be collective processes at country level to be able to help governments improve policies, mainstream hygiene programs for the long term. Next slide. So 1 year later, we're taking stock of the Hand Hygiene for All initiative, its results, and the progress made by national governments. Today, you can see in the map, over 35 countries are working on hand hygiene roadmaps and other related policies. In this session today, we'll hear experiences from around the world as governments work to strengthen hand hygiene programs. We'll hear some success stories in hand hygiene roadmaps from Nepal, institutionalizing hand hygiene in ordinances in the Philippines, and coordinating multiple ministries for roadmaps in Mozambique. A panel will share experiences with hand hygiene as a nascent sector in Egypt, as well as a maturing sector in Nigeria, and how together we can face the challenges that governments anticipate in preventing a drop-off in attention to hand hygiene. Most importantly, we want to hear from you, the participants, on what you think are the pressing challenges and the opportunities in hand hygiene, as we look at what we can do to accelerate our progress to make sure that hand hygiene is a reality for all before 2030 and beyond. So thank you so much for joining us today. Let's continue to join forces and to advance hygiene for all today, forever and for everyone. Thank you so much. And Kit, handing back over to you. I'm really looking forward to today's discussion. Thank you.
Thank you very much, Kelly, for getting us off to a very good start. And I am also really eagerly looking forward to the discussions today. And to continue with the discussions, as Kelly has said, we will be having the first presentation from Nepal. The presentation will be delivered by Sunil Kamar Das, who is the Joint Secretary for the Ministry of Water Supply, Nepal, and he will be sharing the experience of developing a hand hygiene for all roadmap under the leadership of the Ministry for Water Supply in Nepal. Over to you, Mr. Sunil.
Thank you, Mr. Bawa. Respected chair of the meeting, dignitaries, distinguished participants, ladies and gentlemen. Namaste from Nepal. First of all, I would like to thank the organizer for providing me this opportunity to share the case study on preparation of National Roadmap on Hand Hygiene for All. Next slide, please. I would like to thank UNICEF and WHO as the initiation started after receiving a joint letter from UNICEF and WHO to 5 ministries, including Health, Education, and National Planning Commission. We can see later on the left-hand side in the slide. Roadmap will cover a period up to 2030. Kick-off meeting with the participation of secretaries from all 5 ministries and honorable member of National Planning Commission was held. Technical working group has been formed. Major representatives are from Ministry of Health, Education, governments, private sector, etc. After this meeting, the consultative process started with all primary stakeholders. About 12 groups are formed. 3,077 participants took part in the consultative process. Next, please. So in this slide, I would like to share the points on enabling environment for promotion of hand hygiene in the country. As you can see, we have hand hygiene in different policy documents to promote it. We have WASH guidelines and standards to facilitate implementation of the roadmap. Likewise, focused attention has already been given in the sectoral plans from national to sub-national level. Water supply sanitation hygiene plan, we call it WASH plans for rural and urban municipalities is under preparation. Already 295 local governments out of 753 has started the process. Our national target is to complete the WASH plan in next 2 years, and hand hygiene is integral part of this WASH plan at local level. Next, please. In this slide, I want to highlight Right Honorable President's call to action for WASH to break the chain of transmission of COVID-19. It mainly focused on promoting hand washing. In the top right, we can see message from Right Honorable President on the occasion of Hand Washing Day. Bottom photographs have been captured during a month-long hand washing campaign. We can see students participating in the campaign, and in the bottom, we have female community health volunteers. WASH account has been initiated, which also includes tracking of investment in hand hygiene. Honorable Finance Minister and Water Supply Minister also expressed their commitment to support total sanitation program, which includes hand hygiene promotion, on the occasion of Finance Ministers meeting organized by Sanitation and Water for All. Next, please. Now I want to share situation on access to hand washing facility with soap. Data has been taken from different sources like National Health Demographic Survey and MIX. We can see the trend from 2011 to July 2020. We can see a drop in hand washing after devastating earthquake in 2015. More than 5,000 water supply schemes were damaged. But it is good to share that During the COVID-19 pandemic, washing hands frequently with soap has increased over 90%. Family Tracker survey has revealed this fact. Next, please. Next slide, please. Yes, thank you. I am going to discuss briefly about the process methodology for roadmap preparation. Preparation process included formation of technical working group, mobilization of consultant, expert teams, desk studies, developing questionnaires, formats. After developing questionnaires and formats, consultation meetings for engaging stakeholders, mainly health sector, education sector, provincial and local government, development partners, mother groups, students, marginalized groups who were consulted. Idea is to promote ownership on the preparation of roadmap so that it is easier for all of us to own them in the implementation of the roadmap. We have our own experience in preparation of sanitation and hygiene master plan in 2011 and its successful implementation as all stakeholders owned it. As a result, we were able to declare the country as ODFs in September 2019. Now we are in the process of finalizing preparation of a roadmap, and we're expecting to launch the roadmap on Hand Washing Day 2021. Next, please. This reflects on the opinion poll on the availability of materials for practicing hand hygiene and the coverage of hand hygiene. We can see at household level, school level, healthcare facilities, and public places. Opinion poll also provides a baseline data. In many cases, we have baseline data, but in some cases, we do not have. So this opinion poll from the stakeholders is going to create a baseline data. In top right slide, it compares about the availability of soap and water in all 4 categories in 7 provinces. It clearly shows that more attention would be required in province 6, that is Karnali province. In bottom right side, we can see the opinion poll on hand washing at critical moments. However, considering COVID-19 pandemic, washing hand after touching frequently touched surface or objects has been included. And as we can see among the stakeholders, journalists are the most sensitive and empowered in this respect. Next, please. And this is my last slide. We have learned that COVID-19 has provided a great opportunity which raised awareness, and people realized the importance of hand washing more than ever before. However, sustainability of facilities and behavior change is challenging. On the basis of wider consultation meetings, it has been recommended that existing systems and services needs further strengthening. So that will be part of our roadmap. Since roadmap will cover up to a period of 2030, plans should be developed for short-term, medium-term, and long-term. Costing of all required activities needs to be done, as we need to do resource mapping and allocation of responsibility to our partners. Local government will be at the driving seat. So capacity building needs more focus. Strengthening, providing technical package stopping, monitoring from federal government is equally important. And of course, learning from experiences of other countries, especially on sustainability aspect, will be very important for us. So with this, please allow me to stop here. And thank you very much for your attention. Thank you. Namaste.
Thank you from all of us, and namaste, Mr. Sunil, for that very enlightening presentation. And now, ladies and gentlemen, we will continue with the lessons that we're getting from member states. And I will now use this opportunity to welcome Dr. Beverly Ho, Director, the 4th Director of Health Promotion Bureau and Disease Prevention and Control, Ministry of Health, Philippines. And she will be sharing experiences of developing municipal ordinances for hand hygiene in response to COVID-19. Over to you, Dr. Beverly.
Thank you very much. Allow me to just share my screen. Can I be allowed to share my screen?
Dr. Ho, I have your slides. They're
All right. All right, let's go ahead. Thank you. All right, so in the Philippines, we have adopted these 7 priority areas, for which is the basis for all that we do in health promotion and disease prevention. This, in a way, encapsulates the different habits that individuals will have to work on, or communities or settings will also have to adjust to, or build healthy environments on. So, as you can see, area 2 is environmental health. Next slide, please. And environmental health includes um, our interventions in air pollution, but as well access to safely managed water and sanitation and proper waste disposal. You can also see here on the right hand side that our context for implementing all of these are actually in the devolved setup of around 1,500 plus local government. And that means that in the health sector, the national government only does policies and programs, but the main implementation is actually being done by local government units, by mayors and by governors. And so, even with several policies and plans that you will see in the next few slides, we still have challenges in terms of access to safe water and even sustainable hand hygiene practices. So this slide shows you the various national policy frameworks and the policies that we have been using, for which the local governments are supposed to implement. So then the challenge then would be, next slide please. The challenge then would be how to increase implementation or improve implementation by local government units. How do they make sense of these national policies and make it easier to implement at the local level? So we came up with playbooks corresponding to the different or the 7 priority areas that I've shown you in the first slide. And one of the playbooks talks about how to improve hand hygiene, no? Primarily through increasing accessible and well-maintained hand washing facilities, but also incorporating learnings on behavioral nudges around this. Next slide, please. So the following slides, we will show you the different chapters in this very operational playbook, no, so to speak. So first, there is a template policy. So typically, the local government units have local ordinances that they use, and this just means that they can already use this template ordinance and come up or pass a local resolution incorporating the many components of this program. Next slide, please. The playbook also has, next slide, please. So in developing the template policy, obviously we had to have a policy review and consultative process, and we also got the support of the Hygiene Hub while developing this policy template. Also, we had to do cascade with the LGUs and issue out a recommendation through a department memorandum asking our LGUs to utilize these playbooks. Next slide, please. Next. Next slide, please.
I'm sorry, Dr. Ho, there appears to be a bit of a lag in the slides.
All right. So the next chapter is on the implementation timeline. So like many health promotion activities, though, this simplifies the work that the local government units need to do because the step-by-step process for implementation is already here. Next slide, please. It also has a chapter on capacity building of the different people or groups in the community that need to be capacitated with regard to the implementation. Next slide, please. We also have a resource planning section. Oftentimes, people think of health promotion as interventions that are free, no? But they are actually investments and they entail resources and cost, no? So this chapter already puts in what are the needed resources to implement it and how much, no? Approximately the unit cost of each of this. Next slide, please. There's also a monitoring chapter where proposed indicators are actually already put here so that they can just pick and choose, no, or adopt the entire thing. Next slide, please. And also sample communication materials that the LGUs can use or can modify. Next slide, please. There are also stickers that we made here. So these are more for kids, know when they're going to implement these nudges in probably in schools or in local communities. Next slide, please. So these are just some of the known nudges that are being used for kids. Next, please. Next. 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 Yes. So I think that's all from our end. Thank you very much.
And thank you too so very much, Bivaliho, for your presentation. And now, ladies and gentlemen, permit me to invite our next presenter. And the next presentation is coming from Engineer Ana Paulo Cardozo, Head of Department of Environmental Health, Mozambique. Mozambique happens to be the Vice President of AMCA for the Southern Africa region. And Engineer Cardozo will be sharing the early experiences of mobilizing cross-ministerial support for the development of a hand hygiene for all roadmap under the leadership of the Ministry of Health. You're most welcome, Engineer Cardozo. Over to you.
Thank you. Thank you, everyone. Today, I will share the experiences of Mozambique regarding to hand hygiene, the approach we are implementing, the difficulties we are facing, and the progress we have achieved. Next slide, please. Starting with the wash status, hand hygiene access is still limited, both in domestic and institutional settings. Access to hand washing facilities and services in households, schools, and healthcare facilities is alarming. Available data indicates that access to hand washing facilities with available water and soap are 40% in healthcare facilities, 26% in family compounds, and 50% in schools. Next, please. Data available from the Joint Monitoring Program for the years 2018 to 2020 show that we still have a lot to do to improve wash in Mozambique. Access to basic hygiene is 26% in households, and the situation is critical mainly in the rural area. For schools is 15%, and for healthcare facilities are 14%. To tackle water sanitation and hygiene issues, we are implementing a multi-sectorial approach. We create in 2000 a multi-sectorial technical group in WASH, and this technical group is composed of various governmental institutions, civil society organizations, non-governmental organizations, and the partners. This group aims to facilitate technical dialogue related to WASH, to develop norms and standards, to monitor the activities, and also to share experience between different stakeholders. Several initiatives related to the change in behavior regarding hand washing have been implemented over the years. In 2008, we have a national campaign for environmental sanitation and hygiene promotion, which the actions were carried out from the national level to the village. Strategies and plans were developed that focuses on hand hygiene. We have a national health promotion strategy. We have also the action plan for promotion of hygiene and cleanliness in schools and healthcare facilities. And recently, we developed the national strategy for community response to COVID-19. Also, we have been formative research has been carried out to identify the main barriers related to poor hygiene practices. Out of these various initiatives, the following key barriers have been identified over the years: lack of national norms and standards for WASH services in schools and healthcare facilities. Capital investments in healthcare facilities and schools often exclude the necessary infrastructure and services for WASH. Where they do occur, they vary depending on financing agencies. Routine sectorial monitoring systems used by the Ministry of Education and the Ministry of Health do not include water, sanitation, and hygiene indicators. With the COVID-19 pandemic, there was an increase in interventions related to WASH. The COVID-19 pandemic has led to greater government prioritization of hand hygiene, and the hand hygiene practices have increased. A recent inquiry showed that strong general public compliance with hand hygiene is a preventative measure against COVID-19. Up to 80%. The education sector mandated that access to water and hand washing stations are minimum conditions for the reopening of schools. The health sector equipped COVID-19 isolation centers with hand washing stations as an essential requirement for infection prevention and control measures. Markets and other public spaces are being reorganized to reduce the risk of transmission. These include availability of hand washing stations and supporting messaging at entrances and exits. I would also like to share some progress in WASH in Mozambique. We created specifically for multi-sectorial on WASH in healthcare facilities. And this group has developed technical norms on WASH in healthcare facilities. Terms of reference has been complete to carry out situational analysis. Numerous initiatives to improve WASH in healthcare facilities are in progress, with support of key partners, including UNICEF, WaterAid, and World Vision. We are already planning a WASH fit training and we also have a proposal for WASH indicators to be included in the National Health Monitoring System, which includes 4 areas: water, hygiene, sanitation, and management. In relation to schools, government commits to rehabilitation and contraction of WASH systems in the context of the efforts to return children to school. Capacity development to ensure sustainability of service delivery, creation of maintenance teams, reinforced education, promotion of hand hygiene, improve the monitoring of practices through new database. At the community level, mass media campaigns launched by government to increase hand hygiene in the context of COVID-19. The messages are being disseminated by media, radio, messaging in various national languages, and the TV spots. So the next steps, the Global Hand Hygiene for All initiative launched in 2020 presents a further opportunity to accelerate access to hand hygiene services and sustain behaviors. The global initiative complements ongoing government efforts in line with the current state of public emergency, reinforces the importance of hand hygiene to the prevention of COVID-19, and it contributes to making hand hygiene behaviors everyone business. This will prevent infection disease transmission now and in the future. We are planning to organize an advocacy workshop to launch the Hand Hygiene for All initiative, develop an interministerial roadmap to achieve universal hand hygiene, and support the national budgetary process to ensure allocation of funds. We are also promoting the prioritization of hand hygiene investments within other key ministries, including for infrastructures and the promotion activities. Promotion the importance of hand hygiene financing among key development partners is another important step for Mozambique to launch the initiative. Thank you very much for your attention.
And thank you to Engineer Cardozo. Obrigado. And ladies and gentlemen, it is time to go into the panel discussions, but I will first of all ask you to go to the Q&A section and ask questions, please. And let me also remind you that the questions will be asked as much as we can, will be answered as much as we can in the course of this event. And the presentations will also be shared with you at the end of this meeting. And now for the next presentation from Dr. For the group discussions, we will be having, the panel discussions, I beg your pardon, we'll be having two participants, Mrs. Yemisi Akpa, who is the Chief Scientific Officer in the Water Quality and Control and Sanitation Department of the Ministry of Water Resources in Nigeria, and Dr. Ehab Atia, General Manager of Infection Control Department, Ministry of Health, Egypt. Ladies and gentlemen, it is a great pleasure to have you with us today in this discussion. So for the panel discussions, I will have the first question, and I will let the lady to go first before the gentleman can answer. Mrs. Yemisi, how do the country presentations we just shared reflect the experience in your country? Can you tell us about the status of hand hygiene in Nigeria? Over to you, Mrs. Yemisi.
Okay, thank you very much, Kitch, and thank you to all the presenters. That was really insightful. And I think from what they've shared, it also resonates with what is happening in Nigeria. The national status of access to hand washing in Nigeria currently stands at 16% national, and in health facilities, we have only 7% of healthcare facilities with access, and in schools, we have 14% of our schools with access. So this is the this was as at 2019 when we carried out the last national survey under the National Community Mapping survey. But with the advent of COVID-19, we all know what happened with the increased awareness on the importance of hand hygiene, to prevent the COVID infection. And with this, we have seen a real high surge in the uptake of the hand washing practices. Practically everywhere you go to, you have hand washing facilities at the entrance for you to be able to do to wash your hands effectively. And we've also seen, in line with what other countries have also reported, Nigeria has a national hygiene promotion strategy that we developed in the year 2016. And in that strategy, it advises, as part of the components of implementation, the promotion of hand washing with soap is one of the first priority phases for implementation in that strategy document. And also in Nigeria, we have the National Coordinating Platform that deals with issues of sanitation and hygiene. And this body is a multi-stakeholder body with membership across different ministries and organizations. And together, issues around sanitation and hygiene are discussed. And for us in Nigeria, in trying to see that we address the issue of the low access to hand hygiene. In 2019, in the process of rolling out the national campaign on ending open defecation called the Clean Nigeria is a Toilet campaign, we also looked at the fact that we need to integrate hand hygiene as a strong component of that campaign. And in respect of that, we carried out the situation analysis to actually understudy the hand washing landscape within the country, to understand what are the determinants of behavior change, and to see how we can actually integrate that within the campaign and improve access to hand hygiene within the country. Thank you.
Thank you very much, Mrs. Yemisi, for those insightful experiences you've shared. And now over to Dr. Ehab Atia. How do the country presentations we just heard reflect the experience in your country? Please tell us about the status of hand hygiene in Egypt. Over to you. Dr. Ehab Atia, over to you. Now we can hear you. Please turn on your camera, Dr. Atia. Thank you.
Hello.
You're welcome.
Welcome.
So kindly tell us about this. Yes, kindly tell us about the status of hand hygiene in your country.
I didn't prepare any presentation. As you know, I'll speak about the situation from the experience here in Egypt.
Please go ahead.
Thank you. We are in Egypt working in this issue since 2008. As you know, we have started the infection control program, the national infection control program in Egypt at 2003, from about 19 years now. Hand hygiene is our first priority since then. One of the advantages of the pandemic now, as we all experience from the few months past, that the whole population is now oriented about hand hygiene, especially healthcare stuff. Our priority from the start of infection control program in Egypt was establishing hand hygiene in healthcare facilities and for healthcare workers. We have creating the national infection control guidelines, Egyptian infection control guidelines, which have been published in 2 languages, English and Arabic. But we updated the Arabic versions 4 times now. I can show you one of the guidelines we have distributed for healthcare facilities in Egypt. Hand hygiene is one of the assessment we need during the evaluation of antibiotic stewardship and antimicrobial resistant programs also. It is well established since 10 years, from 10 years, that we make one-day assessment each quarter for the healthcare facilities for the adherence of hand hygiene. I think in the few months we have experienced the development of alcoholic rub for all facilities, alcoholic rub and disinfectants also, and sinks for hand hygiene in all schools and governmental places. I'm waiting for other tools that we can share together during the few months that we will experience or we are facing the pandemic. I hope at the end of this session we can put some ideas that we can share together, especially in African region if it's available. And thank you for listening. Thank you.
Thank you very much, Dr. Tia. And talking about sharing experiences across the African region, you can also take advantage of the ASPG to update existing policies on hand hygiene. And my next question goes to Mrs. Yamisi. By the way, I have a question from the chat box that I will read later, but now the question is, there are many countries that are focused on integrating hand hygiene into existing policies. And Nigeria has talked about having the National Hygiene Promotion Strategy. And are there any plans to use the ASPG? Because the ASPG also covers behavior change and hygiene. Are there any plans to use to take advantage of the ASPG to update existing National Hygiene Promotion Strategy of Nigeria? Over to you, Mrs. Yamis.
Okay, thank you very much, Kate, for that. Nigeria was privileged to be part of the development process of the ASPG, and during that process, it was actually a multi-stakeholder process that involved both the national coordinating platforms and the sub-national stakeholders as well. So definitely Nigeria, as being part of that process, would definitely be committed to leveraging on what the ASPG provides, the framework that it provides, to update existing national policies and strategies, to be able to see how we can to improve this policy environment in the country. And Nigeria also is in the process of developing our hand hygiene roadmap, and we are going to be looking at how the ASPG can inform what the plans that will be coming through in that respect. And parallel with the development of the hand hygiene roadmap, we are also in the having an ongoing market assessment of hygiene products and services in the country that will be integrated into the roadmap that's been developed. And all of this will be used in advocating to governments and private sectors and other multi-stakeholder that we are identifying in the process, to see how we can actually actualize these policy provisions and convert them to real actions that can support hand hygiene and in developing sustainable approaches within the country. Earlier, when I mentioned the statistics, the last survey, national survey that we carried out in 2019, but we know that with the surge of the pandemic, there have been a lot of awareness, sensitization, and uptake of the practice of hand hygiene. But we've passed through this process before now. During the time we had the Ebola disease, in Nigeria. And with that, we also had this surge of people washing their hands and all of that. But as that the infection and the fear of that went down, so was the people's adoption of hand washing practices. But we are looking at a more sustainable approach to that. That it will not just be something we're doing because there's a pandemic, around, but something that becomes part of people's behavior and practices. And so all these strategies, the hand hygiene roadmap, also looking at building the market around hand hygiene, so that the facilities are available, and then people are aware, and then they are also sensitized to be able to take this up as a behavior that they inculcate as part of themselves. So we are definitely going to be engaging with the ESPG, because it has provided us that framework that we can also look into to adopt or adapt, as the case may be, to fit into what we need to have within the policy environment in Nigeria. Thank you.
Thank you very much for those very rich responses. And I have a couple of questions from participants. The first question I have here talks about one thing that Mrs. MEC mentioned. It's about the sustainability of hand washing behavior. What are the particular approaches? And this question is open to all the panelists. What are the key steps that you've taken to ensure the sustainability of hand washing behavior, or what are the ideas you have in looking ahead to sustain this behavior that people have actually taken up since the outbreak of COVID?
Okay, if I can come in. So with the advent of COVID,
please go ahead.
Yeah, the development of guidelines, on how for wash interventions, to be able to address the COVID pandemic. And the National Center for Disease Control also brought out different protocols that have to be observed in public places and institutions and all of that. And major among those protocols is the fact that there has to be hand washing facilities, in every location, whether it's in schools or healthcare facilities or public places like markets and parks and all of that. And those were being enforced, and I think they're still being enforced. And for us, we're looking beyond this period where everybody is out on preventing COVID. But once this pandemic is over, how do we ensure that this is sustained? So I think we are also looking at how do we ensure that this also remains on the front border even post-COVID, to ensure that all these facilities that have been provided in all these locations are still functional, and people are still making use of them. And I think it is creating that sustained engagement, sustained awareness. And I think I really appreciate what Dr. Hu to engage people to be able to wash their hands. So not only that the facilities are there, but you have all the skills around that helps them to remember that they need to do this at every point in time. So having all of this all around, and other approaches like engaging in sensitization and all of that. And one thing that we're also doing in Nigeria that the Ministry of Water Resources is also leading on is that a part of the intervention for the COVID-19 is the engagement of youth across all the subnational, that's the local government areas. So those are the local administrative administrations. So we're engaging 100 youth by each of these local government areas that will be involved in sensitizing the population. So they go to households, they go to institutions like schools, they go to churches and mosques, and anywhere where they can get a group of people together to sensitize them on the importance of washing their hands, and also take them through the hand washing process, how they can effectively wash their hands and all of that. In this part of in Nigeria, or maybe Africa generally, there's this idea of washing hands not under running water properly, so in a bowl and all of that, and not even using soap. So this group of younger volunteers have been engaged to take the message out so that people are really aware on the effective way to wash their hands. And we hope that over the period that this youth will be engaged, which is about a 3-month period, we'll be able to create that mass awareness across the country, and hopefully this will result in a huge uptake of hand washing practices in the country. Thank you very much.
Thank you very much, Yemisi, for those innovative ideas on sustaining hygiene behavior change. And let me move over to Egypt. There's a question from the participants, and it goes, great presentations going on. Exciting to note that Egypt has had infection prevention and control program at the national level since 2003, and is well equipped with a national IPC guideline translated into 2 languages. And this question is for Dr. Ehab. What is the current healthcare associated infection surveillance rate in Egypt? What is the current healthcare associated infection surveillance rate in Egypt? And there's a follow-up question to that. What is working for hand hygiene as a core component of the IPC program that can be learned from Egypt? Dr. Atia, are you here to take this question?
Yes, thank you for this question. For the healthcare acquired infection surveillance, we are a participant of the global net of concerning about healthcare acquired infection and GLASS, which concerned about antimicrobial resistant patterns and microbes. We have been working in this program as one of the branches of infection control national infection control program since 2015. We can share, if the kind colleague want, we can share the results of the program since from 5 years till now, if he wants to. As you know, during the pandemic last year, because we are working mainly in ICUs, intensive care units, it have been held in hold. We have been held this program, surveillance program, for about 14% or 40% or 50% of hospital, because they are only receiving COVID patients, which are out of the scope of the healthcare acquired infection surveillance in ICUs. Now we are reworking on the surveillance program again, because the isolation hospitals are gradually returning to their normal activities. And I'm welcoming for any other cooperation or question about this program also. Excuse me, I forget the second question is about to.
Yes, the second question is about, what is working for hand hygiene as a core component of the infection prevention and control program that we can learn from Egypt? That is the question.
From the beginning of the National Infection Control Program, I think we have done hundreds of thousands of training courses for care workers, sometimes for community members, about the standard precaution, which the first one of them is hand hygiene. We worked on the facilities itself for infrastructure to provide sinks wherever it is needed for, and we have supply them by disinfectants. We do monitoring for all hospitals in Egypt centrally. My department is doing this annually. Each facility must be visited and monitored for the standard precaution adherence, minimal for one visit. We have here about 550 major hospitals around Egypt. We have to visit all these hospitals once yearly, and the government, we have 27 governorates here. They visit and monitor their hospitals once monthly. So I think we have improved this issue for the 19 years past from the beginning of the National Infection Control Program till now. I hope I have answered the question.
I think you have answered the question. Thank you very much. And we have another question for both panelists, and it says, how have the panelists engaged civil society in the process of developing and implementing hand hygiene roadmaps? And in other words, have the civil society been involved? Have there been broad consultations with key stakeholders?
So in Nigeria, the answer is a big yes, because in the process of the development of the Nigerian hand hygiene roadmap, we engage right from the national level to the sub-national level. And the engagement includes, the coordinating platforms, which includes the civil society. So we try to identify all key stakeholders, basically, and the civil society organizations are a critical, part of the key stakeholders that were identified and engaged at the different levels. Thank you.
Thank you very much, Mrs. Yemisi. Any response from Egypt on the engagement of the civil society in developing the roadmaps?
Our first concern in infection control department here is healthcare facilities, but during the last 18 months, the borders are not clear of who will work where. So we have engagement in the civil society. We supply all the government working place by posters, which enthusiasm, trained them for monitoring their people for their hand hygiene attitude and practice. We have create 2 cartoon movies for the public about the importance of hand hygiene. I think there is a lot of work. Maybe I forget some of them during the pandemic for hand hygiene, and there is a lot of engagement for society, NGOs, especially for hand hygiene activities. I think I can prepare some presentation for this in second meeting.
Thank you very much, Dr. Ehabatia. And this question, the next question, we have about 12 minutes to go, so we will take 3-minute responses from each of you. And the next question is very important. It's about financing. To what extent are your national hand hygiene roadmaps or policies costed? Do you know what is the financing gap for full implementation of your roadmaps or policies? Why? Because knowing these specific figures will help advocates and campaigners to really be able to follow up to ensure that they the figures are made, the finances are made available. Who wants to go first? Madam Yemisi, over to you.
Yes, okay, thank you for that. So Nigeria, we are still in the process of the development of the hand hygiene roadmap. It will be a costed roadmap, so it will have what the cost, the financial implication for implementing the roadmap will be. So currently, the finance landscape is the fact that in most budget, we don't have a clear budget line that says this is for hygiene, implementing hygiene activities. So most of the time, what you get is you have some sanitation projects that we can implement hygiene activities under that. And I think with the roadmap, we'll probably be, bringing out, the clear, what the financing implication of implementing that is. That will probably come with some recommendation on the need to have, clear budget lines, for implementing hygiene activities, issues around promotion, sensitization, and the infrastructure as well. And this is the area where we feel the private sector can come in. So it's trying to create, making the enabling environment conducive for them to be able to come in with providing the infrastructures and the innovations that can come into ensuring that we have a very robust landscape for hand hygiene within the country. So we will not only be looking to the government for financing the roadmap. The hand hygiene roadmap will be looking at the roles of different stakeholders, government, private sector, development partners, and also should be able to we'll be defining what each where these financing gaps can be bridged. So we are exactly looking forward to having the process of the hand hygiene roadmap concluded, which will help us to come up with this document that we can use, to advocate for increased funding and targeted investment within the hand washing landscape in Nigeria. Thank you.
Thank you very much. Dr. Atia, do you know how much you need?
As an exact number, so it is very difficult to put it. But until now, there is no problem for supplying the facilities with hand hygiene equipment supplies. It is built in the government budget. And we have faced a lot of problems during the pandemic. As my colleague from Nigeria said, the NGOs and private sector supply us with whatever we needed during the pandemic. And then, I don't see that it is going to be a problem during the coming few months. But there is no exact number about hand hygiene budget needed till now.
Thank you very much. One last question. We have time for just one last question. Fine. So, okay, it's almost time. We have 2 minutes, so we don't have enough time to take one last question. So, on behalf of the organizing team, I thank you very much, Mrs. Yemisi and Dr. Ehab Atia, for your contributions and very rich experiences that you've shared with us, and we've learned a lot from you. And now, ladies and gentlemen, before we go towards the concluding part of this webinar, let me share some of the reflections that we over the course of this event. And in the course of the event, we have heard of existing policies for hand hygiene and others that are in the course of development. And we know that we now, more than ever, there is the need to develop these policies, and there is a guide for developing these policies. The ASPG Chapter 5 of This document talks about hygiene and behavior change, and it underscores the need for mainstreaming hygiene as a core component of either hygiene policies or as a standalone policy or strategy that we want to take on. And already, as Mrs. Yemisi has said, the Minister for Water Resources of the Federal Republic of Nigeria, Honorable Suleiman Adamu, expressed the desire of the government to use the ASPG during the launch of the ASPG. And we know also that there is need to have costed roadmaps. And we know also, as we have heard, that the funding for these roadmaps do not need to come from government. They can be sourced from different sources. So that is a very, very enlightening discovery that is available in this event. And also, there are opportunities for expanding the ASPG to Asia. As we have heard, there are opportunities for countries in Asia and Latin America to leverage the ASPG. The ASPG actually went through a very robust development process that involved a number of activities, which includes desk review, which showed that there is no other document, that a similar document like the ASPG. There were also broad consultations with key stakeholders from across other regions, including Asia and Latin America. As a result, other regions can learn from the ASPG and also be able to adapt it. We can build on the long-standing intercontinental peer-to-peer learning between Africa-SAN, Latino-SAN, SACO-SAN, and ASI, so that we can build on how we can use the ASPG across different continents. We also know that pre-investments in hand hygiene tend to result in better performance during crisis. We also know and I've heard that improving hygiene needs multi-stakeholder collaboration that should involve all the critical stakeholders in the process. And so, although a pandemic tends to focus attention, the crisis is not the primary reason to improve hand hygiene. It is always a good idea to wash your hands, as it prevents so many respiratory and diarrheal diseases. We know that we need more evidence on what works. We know that policies and roadmaps are important. We know we need strong supply chains, and we need to drive demand through behavior change. But we also know that we need data on what combination of these efforts is most effective. It is with pleasure that I announce to you that AMCAL is putting in place a system to coordinate and report the implementation of the ASPG to support all the efforts that we've talked about here on improving the ASPG to improve policy on hand hygiene. And now, ladies and gentlemen, distinguished participants and our highly esteemed keynote speakers, and to invite Dr. Maria Nera from WHO to give the closing remarks. It's bye from me. Over to you, Dr. Maria Nera.
Thank you. Thank you so much, Keith. It has been really inspiring. I mean, I've been following with a lot of interest the presentation, and I think we have plenty of inspirational examples from countries, and even very concrete questions that people wanted to be answered. I think we have the privilege to hear from the countries how they were facing all of those challenges. I was particularly inspired to see that not only they have good experiences, but they have very clear roadmaps, strategies, plan of action. I mean, really very concrete issues that they are putting in place and that the governments are following. So I really hope that this could be an inspiration for many others, that we can learn from each other, and we can use all of this to scale up all of this action that is needed. And of course, this acceleration is so much needed. you know that I'm sure you all are aware of the recent JMP report that UNICEF and WHO JMP, in which they are telling us that if we want to reach if we want to make more progress to improve the hand hygiene globally, we need to multiply by 4 the resources that are allocated and to make this, to achieve this universal hand hygiene, because the SDG is really at risk. And multiply by 4, for some people, might look a lot of investment, but in fact, when you look at what is the cost of not investing on high hygiene universally, I think if we put things into the right balance, the right cost effectiveness, if we have the opportunity to discuss with governments and policy makers, I think this argument will be so obvious and so clear. Nothing is more cost effective than to invest on facilities for people to be able to wash their hands. And I think at the time where we are talking about massive and global vaccination campaigns, the idea that people can be vaccinated against a virus that is transmitting, among other things, by lack of hygiene in our hands, I think is quite strange that we push for the vaccination, which is very, very much needed, but without making sure that the vaccine will go with a minimum facility for people washing their hands, at least when they are performing as health professionals or when people are coming to the healthcare facilities to get the vaccine. So I think it's such a basic logic, common sense, and then non-regrets and an investment that will be sustainable that we need all of us to really accelerate and to move on a different speed and on a different level of ambition. I really hope that the leadership that was demonstrated today, the different positive initiatives that were presented and experiences could inspire many others, could help really to accelerate. And we will be having a similar meeting to this one to show that this call of today and this exchange of experiences have been really very positive and very contributing very much to what we want to achieve. As I say, this is a non-regrets investment. All the discussions around now how to recover from COVID-19 on a healthy and green way will, as a minimum basic and recommendation or prescription, will have access to safe water, sanitation, and of course facilities for soap and hand washing as something which is so basic that normally we shouldn't even be should be discussed today in 2021. I think we are all perfectly convinced what we need is to now invest a little bit more and make our investments very relevant to protect people's health and reduce our vulnerability to even to next crisis. So with all of that, Kish, I wanted to thank all of you for joining. I think it has been a real pleasure to be part of this. As WHO, you know that you can count on all our engagement and support, and we will be ready to accelerate together with all our partners and of course UNICEF and many others, and particularly the governments and the countries that are very much at front and putting these things together. So good luck to all of us. Thanks for joining. Thanks for this opportunity to be with you at the end of this very successful meeting. Thank you.
Thank you too. And thank you all. Do have a nice day.
Bye. Have a nice day. Bye.
Thank you. Namaste.
Namaste.